All right, all right, all right. Hello, everyone. This is Della Major, aka the Game Changer. I'm coming to you live one more time again. Each particular week I'm going to be sharing some information from my nonprofit Live, which is a organization that is thriving towards transforming the lives and providing quality information and care to renal and kidney health patients. And so one of the things I'm going to talk about today is I received something that came across my desk that asks for us to share. And this is really important because this is really something that really affects not only renal patients, but just really patients within the African American community, Hispanic community, indigenous community. Most of them are what you might say low income and health communities environment. And so this information that I received happens to relate to the COVID-19 virus. And one of the things that was talked about is that if you are uninsured and maybe you receive medical treatments or care or plan, or even if you was hospitalized for COVID-19, look, I want you to stop worrying. I want you to not fret, because I know many of you probably receive these enormous healthcare, enormous hospital bills, enormous bills that you might have received, and you're probably thinking to yourself, how am I going to pay this? But there's something I want you to know that is under the act there, the CARES Act for that was created, that was actually implemented for the COVID-19. You don't have to worry about it. Why? Because it pays for your hospitalization and for the care that's related to COVID-19. So basically, what am I telling you? Don't fret. Stop worrying. Why? Is you are already covered. This is really, really something important that I wanted to get out today, because one of the health disparity and inequalities that's inside of the healthcare for low income and for minorities is really a lack of information. This information is not so easily afforded unto us, and so it takes advocates like me and other people to really come out and just share this important information. One of the other things that I want to share with you is that you need to be well informed. You need to be an advocate. You need to be able to come and really state and share this information and speak up for yourself. One of the purpose and the missions for my nonprofit Live is actually being able to go out to advocate, to educate, as well as to empower patients, specifically within the renal community, but also patients, caregivers, and then any other stakeholders that's affected in this arena, letting you guys know you have not only rights, but at the same time, your care is important. And so we under Live, our goal and our mission is to promote quality education, quality healthcare for patients by a patient. You see, I know what I'm sharing because of the fact these are the things that even myself that I go through. And so one of the information and one of the causes and purpose of even starting this nonprofit is to make sure individuals like me that our voice is up front and center. So if you are a patient, specifically within the renal community, again, I invite you to join and to like our Live Facebook page. Why? Because my nonprofit, that's what we are all about. It's information, education, and empowerment. It's all about making sure that the patient's voice is up front and center. On Sunday, January 24th, I'm actually going to be doing my very first launch. And I'm going to be sharing information not only as me, myself, as a subject matter expert, but I'm also going to be talking about me as a patient and then sharing some very vital key information and significant things that you will need to know from not only organizations that you associated with, but that will help you to be able to have that quality healthcare that is going to be needed to give you what? that life, that quality life, to make you not only just survive, but to thrive. And so I hope that you definitely continue to come to the Live Facebook page, come to my page to receive this information, because while we're going to have some great things on that day, I know we have some giveaways, and I don't want you to actually miss out on it. So join me again on January 24th, right here on Facebook Live. We're going to be sharing some valuable information, and then at the same time really just honor you as a patient, because why? You are the most important piece. So take this information. I included an article that was shared inside of the post, so I want you to read that article and share that article with any and everyone that you know who's been affected and did not know that, yes, they are covered. That is something very, very important. So thank you for joining me again on today. I look forward to seeing you on January 24th. Stay tuned for a lot of things that I'm going to be sharing coming up. But if you have not already liked my page, I want you to go to facebook.com. YouCanLyve. Remember, live stands for living your life victorious and empowered. And that is what Live is standing and all about. So I look forward to seeing you soon. God bless and have a phenomenal day. Thank you.